Hello, I'm James Morris, Fire Chief and Emergency Manager for the City of Westland. Today, I'd like to share with you information regarding COVID-19 testing and availability. Westland has experienced a high number of COVID-19 cases. Access to testing has been in short supply and is an obvious hindrance to virus control. COVID-19 testing is a great option if you need assurance testing to see a family member in care facilities, need to travel, or simply need peace of mind. If you've been feeling under the weather or you were in recent close contact with someone with COVID-19, you're probably looking into your COVID-19 testing options. And if so, it's likely that you've also become quite confused by all the different types of testing available. Terms like PCR, rapid testing, and antibody testing are splashed across websites talking about COVID-19, and it can be hard to make sense of what they mean and which one is right for you. I will provide a brief explanation of the differences between the two most common tests to diagnose COVID-19, rapid antigen test and the polymerase chain reaction PCR test. A rapid antigen test can be administered for individuals with or without COVID-19 symptoms. This test involves collecting nose and throat secretions via nasopharyngeal swab and then examining them for protein fragments specific to the COVID-19 virus. While these tests provide quick results within 15 minutes, they are generally considered to be less accurate than the PCR test. It's common to get a false negative, which is a result that indicates the individual does not have the coronavirus when they actually do, or a false positive, a result that indicates a person has coronavirus when they actually don't. If you are feeling under the weather and received a negative rapid test, you may want to receive the PCR test for further confirmation. However, when administered while someone is at the peak of their infection, rapid antigen tests generally provide accurate results, as this is when the virus levels in the body are at the highest. The PCR tests are similar to the rapid test in several ways, as they can be administered to those with or without symptoms and are conducted with a nasopharyngeal swab. But that's where the similarities end. PCR tests are considered the gold standard when it comes to COVID-19 testing. In fact, if you have ever been asked to show proof of a COVID-19 test, you are probably required to provide results from a PCR test. These tests provide more accurate results than rapid tests, and that's because they use the polymerase chain reaction, PCR, to identify the viral genetic material of COVID-19. This genetic material can be detected while a person is actively infected and also after the acute illness. The downside to PCR tests, of course, is that the results are not as quick as the rapid test. The general timeline is 2 to 5 days, although it can be longer during peak periods. The Biden administration has pledged to distribute 1 billion rapid tests. These rapid tests can be ordered online at covidtest.gov. Every home in the U.S. is eligible to order 4 at-home COVID-19 tests. The tests are completely free. Orders will usually ship in 7 to 12 days. Order your tests now so you have them when you need them. If you need a COVID-19 test immediately or need more than 4 tests, please seek other testing resources nearby. Westland City Hall has drive-thru testing on site. This is a PCR test and results are typically available 48 to 72 hours later. Some people have reported longer wait times to receive their results. This can be understandably frustrating. The delays can be attributed to laboratory specimen overloads as well as unexpected staffing shortages. Rest assured, the system is working at maximum capacity and we appreciate everyone's patience. Remember, no-cost antigen and PCR tests are available to everyone in the United States, including the uninsured, at more than 20,000 sites nationwide. The City of Westland website has useful tools within the Coronavirus Hub to access both vaccine and testing sites alike. Wayne County has also allotted cities a small supply of rapid at-home test kits. Based upon the formula used, which is a combination of the Social Vulnerability Index and the census of our community, Westland will be allotted 1,475 test kits. Distribution plans are not yet determined. Over 14 million vaccine doses have been administered in Michigan alone, and everyone 12 and up should get their boosters within the appropriate recommended timelines. Governor Whitmer has set specific goals such as getting 95% of eligible nursing home residents booster dose by the end of January. Mayor Wild and the Vaccinate Westland Task Force continuously monitor the pandemic and its effect on our community. Consistent efforts with vaccinations, boosters, and testing strengthen our resilience to safeguard residents and visitors alike. Hand hygiene, source control of those that are sick, and healthy lifestyle habits can all help to sustain and improve general wellness. The City of Westland understands that this pandemic has been a challenging, long ordeal, and you may need other help. If you feel like you need crisis counseling or just need to talk with someone, there are mental health resources available. For free confidential support from a Michigan Stay Well counselor, please dial 1-888-535-6136 and then press 8. This number is available 24/7 and a welcome reminder for everyone to please be kind to your mind. Thank you for your attention and stay safe, Westland.